Baseball injuries in our pitchers are rising at an alarming rate. It makes you start to wonder if we're actually really helping our baseball pitchers. 74% of all pitchers are reporting pain while they're throwing. And now Tommy John surgeries, which used to be reserved for professional athletes, is becoming much more common in our younger athletes. Up to 57% of all the UCL reconstructions are done in the United States on athletes between the ages of 15 and 19 years old. So certainly our baseball pitchers are suffering some of the most severe type of injuries, and that are limiting their days in pitching. The good news is, following an injury, players will undergo rehabilitation and most will return to sport. However, they'll have significant performance deficits and up to half will be injured again. So what are we missing? Certainly pitch counts and guidelines have been set to try and protect pitchers from excessive volume and breakdown over the course of a season. However, as we've seen, injury rates and pain is still high. So we need to go beyond just the pitch volume and pitch counts. What else can we address? Most rehabilitation providers to this point have focused primarily on the shoulder. They don't consider the full body connection that is required to pitch at this level. The body is connected by the kinetic chain through upper and lower body mechanisms. So we have to also consider the thoracic motion, hip motion, and dynamic balance in addition to shoulder range of motion. Classic risk factors associated with the shoulder have been total arc and gird. Total arc of motion is when there's a bony retroversion that occurs when you throw when your growth plates are open that causes for excessive external rotation on your throwing arm and decreased internal rotation on your throwing arm. Now, this bony shift is completely normal as long as it's symmetrical relative to the non-throwing side. If it is out of balance, then we call that GERD. It's a glenohumeral internal rotation deficit measured by that lack of internal rotation motion. These are the classic risk factors that are in the literature that typically have been treated. But now new emerging risk factors are starting to come out, which are also showing to be important. Hip internal rotation range of motion, thorax range of motion, and dynamic single leg balance. All are mechanisms required of the pitching motion, and when are dysfunctional, can lead to excessive stress on the throwing shoulder. Can we treat these risk factors to reduce the incidence of a time loss injury? The answer is absolutely. We should be. And the problem is, I just don't think we're actually looking at those risk factors and treating them in entirety. Now, one study did show in a randomized controlled study in youth baseball players that if you look at these primary risk factors and develop an injury prevention model based off them, that you can get reductions in injuries. Sakata et al. In 2018 and 19 showed that if you use this kind of general program with youth baseball players, that you'll get about a 50% reduction in lost time injuries. The cool thing is, those impairments also improve as well. So if you give exercises to improve shoulder internal rotation, guess what? It will. If you give exercises to improve thoracic spine and hip range of motion, it will as well. So when you're rehabilitating these individuals in your clinic, make sure that you never leave a modifiable risk factor on the table. This is so important that you don't send them back to sport with some sort of impairment that you could have easily cleaned up in your practice. The cool thing is, as you follow the functional movement system approach, it will tell you when they have the risk factor. You can identify these impairments along the way. So if you follow this approach, you're going to get your patient back to sport, feeling good, and hopefully even reducing that 50% incidence of injury even more.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.